For all the latest updates, subscribe to News9.
Hello, you are watching News9 Digital with me, Amrita, and I'm going to be talking about the various kinds of drugs which are currently in use to treat COVID-19 patients. In the absence of a proven vaccine, these drugs have become the go-to alternatives, but because of their significant side effects, they have not become the vaccine. So let us take a look at some of these drugs which are currently in use. Now, the recently approved drug for limited purpose COVID-19 use is the HYDROXYCHLORO drug, which is a drug to cure skin ailment like psoriasis, and it has been approved for limited use among moderate and severely ill COVID-19 patients. Now, the drug is used to treat the cytokine release syndrome in moderate to severely ill patients. Cytokine release is nothing but the overreaction of the immune system in our body, which results in inflammation of several organs. Moving on, the second kind of drug which is in use is hydroxychloroquine, which has been debated across the world. Now, hydroxychloroquine has shown effectiveness in some patients, while at the same time researchers have shown that the use of hydroxychloroquine has not been as effective or significantly effective as compared to patients who are not given this particular drug. In fact, some of the researchers have also claimed that hydroxychloroquine raises the risk of some of the patients dying of cardiovascular disease. The third kind of drug is called Favipiravir. Now, Favipiravir is an antiviral given to inhibit or prevent viral replication. Now, it is being used among moderately symptomatic COVID-19 patients, but access to this particular drug has reportedly been not easy. Now, the other drug is remdesivir. Remdesivir is an antiviral drug first developed for Ebola in 2014. Now, this particular drug has also been used to treat COVID-19 patients, and reports also suggest that the United States has virtually brought off almost all of the remdesivir stock in the entire world, and that other countries would now have to wait at least 3 months before they can avail their stocks of remdesivir. Now, this particular drug is also being investigated in World Health Organization's solidarity trial of the COVID-19 vaccine. Moving on, the other kind of drug is azithromycin. Azithromycin is just like all other antibiotics, which does not work with viral infections. In fact, this kind of drug is used to decrease the bacterial infection among patients. Now, this is the most widely prescribed kind of drugs, but some people, some doctors and researchers also claim that the extensive use of such drugs can worsen the antibiotic resistance among people. The other kind of drug is the oseltamivir. Now, this particular antiviral agent is prescribed for treating symptoms, influenza symptoms related to COVID-19, and it does not actually treat the disease. Now, just like all the other drugs, this drug also treats the various symptoms related to COVID-19, trying to bring down the fever, headache, body pain, or other such symptoms, and does not actually treat the disease itself. Now, the other sort of method which is widely used is plasma therapy among critically ill patients. Plasma therapy is also, like hydroxychloroquine, is widely discussed. Now, plasma therapy is plasma is taken basically from recovered COVID-19 patients who might have developed the antibodies, and then that plasma taken from the blood of the COVID-19 recovered patients is transferred to those who are still ill with COVID-19 disease. And this particular antibodies which is available in the plasma is supposed to help the patients recover from the disease. Now, the next kind of drug is DEXAMETHASONE. DEXAMETHASONE is the only drug so far which has shown a striking impact against COVID-19, and is also one of the oldest and one of the inexpensive kind of the drugs currently available. Now, current evidence does show that dexamethasone can reduce deaths by nearly 1/3 in patients with severe COVID-19 infection. However, doctors also caution that the use of dexamethasone earlier during the stages of the disease among mildly symptomatic COVID-19 patients might result in the immune system later on not being able to fight off the disease by itself. Now, the next kind of drug is called the tocilizumab. Now, tocilizumab is a injection which is originally used in patients with arthritis. Now, it is being widely used to counter the severe inflammation called cytokine storm that occurs in some COVID-19 patients. Again, cytokine storm is nothing but the overreaction of the immune system. However, this use of this particular drug has also been risked with bacterial infection being raised. Now, the other kind of drug is doxycycline. Doxycycline is an antibiotic which is used to fight infection in the urinary tract, eye or respiratory tract. And finally, the HIV antivirals called ritonavir. Finally, the HIV antivirals called ritonavir and iopinavir have also been recommended for use against COVID-19, and they are also being investigated in the solidarity trials led by the World Health Organization. Now, all of these drugs are either used singularly or in combination of one or three drugs. However, not all of these drugs are completely effective in treating COVID-19. And also, one needs to keep in mind that these drugs are to be used only with a doctor's prescription and not to be used unilaterally or by one's decision. You can leave your opinion in the comment section down below about what you think of the various kinds of drugs which are currently in use to treat COVID-19 infection. Also, like, share and subscribe to News 9 Digital.